Hi guys, how are ya? Doing good. I'm out of the hospital. I was only in there for 4 hours. I wanted to talk to you guys today about what to expect when you go to the hospital with a panic attack or trouble breathing or a chest pain. So that morning, since about 6:30 that morning, I got in a shower and my heart was beating kind of fast, and so I took my son to school and I drove myself to the hospital and I signed in. And I was having chest pains and trouble breathing. And note to anybody, if you want to get through to the ER quickly, chest pain, trouble breathing. I'm just kidding. Um, but the reason why I went that day was because I had this chest pain that was right here and it was kind of spreading like towards each side of my chest, and I couldn't get rid of it. I was having trouble breathing. So with this disease, with anxiety, with depression, with PTSD, the longer you have this, your body's going to create different symptoms, more symptoms, weird symptoms. Um, you'll get like I said, my newest one is facial numbness. Hmm. Okay. Well, when you can't breathe, then you're hyperventilating. Your lips and your hands and are gonna go numb. But my palms were just like sweaty, sweaty, sweaty this morning. So what's gonna happen when you go to the ER? You're gonna tell them I'm dying. I'm having chest pains and I can't breathe. So they're going to give you a full, what they call a cardiac workup. She takes me into triage. She takes my blood pressure, my heart rate, and my oxygen level, my pulse ox. So my blood pressure was like 123 over whatever, and kind of high for me because when I do have a panic attack, I take Ativan, which I'd only taken a half that morning because I tried to beat this myself. I tried to meditate and do some yoga before I left. Didn't work. One of those instances, like I told you before, where your body's going to take you on this ride and say, give you the big F you when you're going on this ride. One of those days. So I tried everything before I went. I couldn't get my heart rate down, and your heart rate not supposed to be up that high for too long. Now, if you're exercising and whatever, yes, your heart rate's going to be up. But when you're sitting here, like I'm talking to you, and your heart's beating, 123 minutes, that's not good. Normal resting heart rate between 87. Well, some people it differs who you ask. 70 78, 87 range is good. So I went to the hospital and she triaged me, and my oxygen level was 100%. My heart rate was 123, which, she's like, oh, and I said, okay. I said, I'm having anxiety, been dealing with this for 15 years. I just couldn't get rid of it myself, and that's why I'm here. When you explain yourself 9 times out of 10, everybody's going to be, I mean, they were very, very understanding. Oh, okay, honey. Well, we're just going to go ahead and do the full workup on you just in case, which is fine for me because a person like me who doesn't have insurance can't go to their doctor every, 5 seconds when they're having a panic attack. And then the next step, they're like, okay, we got your vitals. We're going to give you an EKG. So I went into the EKG and I told the guy, I said, let me know when the 10 seconds. He says, you've done this before? I said, yeah. EKG takes 10 seconds. So when you're flipping around and you're bouncing and you're trying to breathe, I said just let me know when you're ready. So he hooks me all up. All right, he's like 10 seconds and I'm like you're just like straight as a board, And it's crazy because you're like you think to yourself, okay, I can, I can get myself still for 10 seconds, and then when he's done, your body's like this and you're shaking and you're, what the hell is that? So then the next step after your EKG, you're going to get a chest x-ray. Well, they took me to the room first, hooked me up on the heart monitors, which gives you more anxiety and puts me across from the nurse's station. Okay. So somebody that has anxiety, they're by themselves and they want to hook you up on all this stuff, which is normal. They're doing their job. And then somebody like me walks in like, this is what it is. I'm telling you, I had only taken a half of Ativan before I got there. And because they're like, what do you need? What do you want? Um, I have a good relationship with my hospital and my urgent care. So let them hook you up. They're going to hook you up on a heart monitor, blood pressure cuff. They're just going to monitor your heart rate. Well, she hooks me up and I'm in the 130s now because I said, this is making me more nervous. I said, and she's like, oh, okay, I'm going to get the doctor. So the doctor comes in. I said, I've been dealing with this for 15 years. I understand you guys have to do what you got to do, but I have to poop. When I get anxiety or have an anxiety attack, I have instant nervous poop just like that. Now, I may not be able to poop for a month. I get a panic attack and it's just like, you know. And she's like, oh, okay. And I said, all these machines, the buzzing is making me more nervous. I said, I'm going to take my other half of Ativan. She's like, I didn't hear that. I said, I know you didn't. I said, and I'm going to try. I said, I just want you, to do what you need to do. She says, okay. Well, in comes the blood work. They're going to test they're going to give you a cardiac workup. She gave me everything because I hadn't been to a doctor or the hospital. I mean, I got a full CBC. But anyway, when your heart is in distress, it puts out potassium, and it puts out a hormone called, not a hormone, but a chemical called troponin. So that's what they look to test for. So in comes, the blood work. I hate needles anyway. And they take my blood, and so I'm back and forth. I'm not hooked up on these monitors because it's making me more nervous. So, of course, the second half of the Ativan kicked in, and I'm like, I mean, who takes a whole milligram of Ativan? I can't do that, or else I'm out. But, I try to manage and control it myself. As I've been told, you're spitting on the fire by only taking a half a milligram of Ativan. I said, okay, whatever. But because I want to work through this and I want to do this myself. So first round of blood work came back good. But she wanted me to stay 2 more hours. Normally the heart enzymes go every 4 to 6, but because I was calming down and my heart rate was still, 110, 112, 114, it come down from 120. She was okay with, doing my heart enzymes in the next 2 hours. So they did that again. Nothing had changed, no potassium, no Patron in the blood, so I was good. So I wanted to run you guys through what to expect when you go to the hospital. I know it's going to make you more nervous. It makes me more nervous even to this day because I worked in the medical field. I've been around. I know exactly what they're doing, which makes me more anxious. That's why I don't go sometimes when I should. But always, always go. Your anxiety is going to mimic a heart attack. Your fight or flight's going to kick in. Your heart rate is going to go. So you got to look at that and say, hey, my body's working as it should. Even though my heart is pounding out on my chest, I'm sweaty, I'm clammy, I can't breathe. It's doing its job, and it's very hard even for me to grasp. So, but you got to remember that. So, I was let go. They're like, you have generalized anxiety disorder. I'm like, thank you. I said, but I just want to make sure my heart is okay. And then she says, well, you are at that age. I'm like, at what age? And she says, well, you're 41. And I'm like, uh-huh. Well, you're a smoker. Uh-huh. So I said, I get it. I totally get it. At that age, whatever. But I have cut down on my smoking. It's been very, very good. So I wanted to, run you guys through what happens when you go to the ER. Now, my first year, I was on a heart monitor. I was sent home with a heart monitor of 24, 48 hours. Every test in the world, EKGs. Although I have not done a stress test because I am not running, nor am I going to be laying flat and you're going to inject something in me and make my heart race. No, not going to happen. It just it makes my boobs sweat just even thinking about that. So no, but I've had echocardiograms out the yin yang. Heart's strong, heart's good. So, like I said, you guys, this is a journey. You're not always going to be able to control it. You're not always going to be able to meditate it out. You're not always going to be able to yoga it out. And you're not going to always be able to ground yourself and center yourself. And that's okay. That's the journey. But we keep breathing and we keep striving for that place and hoping someday that you're going to get to that place where you don't have to keep running to the ER. But sometimes you do, and that's okay. So I just wanted to let you guys know what to expect because it was, and like I said, it's still very scary for me to this day, only because I worked around the medical field and I know what they're doing. I know why they're, but like I said, I know what they're doing. I know why they're doing it. It just still makes me more anxious, you know. But thank you, Jesus. Nothing was wrong. Heart's good, strong. EKG was in tachycardia, but that's only because my heart rate was so high. So there's no damage. There's no nothing. Thank you, Jesus. So, try not to let the hospital, they're very, very scary places. Try not to let the hospitals upset you even more. And if they do, you let them know and tell them, I think I'm having anxiety, but do what you need to do, you know. But like I told her, the machines are making me more nervous. And she was fine. Okay, we'll take them off, you know. But you let me, she said, you let me know if you have any other. I said, I will. You'll be the first to know, believe you me. So, and then, but at the same token, it can comfort you and to know that if something is wrong, you're in the right place. So I just wanted to check in with you guys and let you guys know that, you know, that's the experience and that's what to expect when you go into the hospital. And always remember that you're safe, you're calm, and we are breathing and we are always fighting. Okay? We're fighting this together. All right, guys, I will talk to you soon.